Agape is proud to present you one of the most advanced and uniquely designed fully automated clinical chemistry analyzer, Miss Banano. Miss Banano offers up to 200 tests per hour. The reagent tray provides 24-hour non-stop refrigeration at 2 to 12 degrees Celsius. It stores up to 40 reagents and samples. The sample tray accommodates primary tubes, aliquot tubes, and micro-insert. Miss Banano uses disposable cuvettes in the 80-position reaction tray to avoid carryover and cross-contamination chances. The multifunction reagent or sample probe is incorporated with liquid level detection, collision protection, inventory checking, and automatic interior and exterior washing. Miss Banano is incorporated with an independent mixer probe that makes it compatible to perform immunoturbidimetry assays with ease. Miss Banano comes with optional internal barcode reading, which enhances the sample and reagent management. Miss Banano is compatible with major LI systems with bidirectional interface transmission. The optical system utilizes spot photometry with tungsten halogen lamp source and 8 wavelength filters ranging from 340 nanometers to 670 nanometers to accommodate most of the clinical chemistry testing requirements. The onboard cooling facility for samples ensure stability for controls or calibrators used. Miss Banano is designed with a user-friendly software with highly exceptional features. Live status for sample positions with different color indication. Live status for reagents. Real-time display of running status of reaction cuvettes with live reaction graph. Real-time monitoring of reaction curve. Simultaneously display primary and secondary wavelengths. Calibration classification. Linear curve type, single point linear, 2-point linear, and multi-point linear. Non-linear curve type, log 4p, log 5p, exponential 5p, polynomial 5p, and spline. User-defined virtual trays. Easy sample request process. Anytime, anywhere status available. Direct access or profile-wise sample request. Added facility of calculated test parameters. Probe stop function. While running the machine, user can stop probe and easily load samples. Carryover option for avoiding cross-contamination. Auto dilution for high linearity sample.
Arterial blood gas analysis. Arterial blood gas, or an ABG, is a blood gas analysis used as a diagnostic tool to assess the acid-base status of the patient and help provide further information in analysing the partial pressures of gas in the blood. Blood is obtained from the arterial circulating system in a specific syringe and is then run through a machine where analysis occurs. When caring for a patient who is deteriorating, it is vitally important to treat the signs and symptoms of the patient. Arterial blood gas interpretation is one of the many additional diagnostic tools used to identify the problem. Critical thinking skills when analysing ABG data are imperative. Linking the patient's presentation with their results is crucial to patient recovery and improving patient outcomes. When interpreting an ABG reading, it is essential to know what values are considered normal. From this baseline, you can then begin to recognise significant variations in a patient's results. The first value is the pH, power of hydrogen, which measures how many hydrogen ions are in the sample. This determines if the blood is acidotic or alkalotic. Normal values for pH range from 7.35 to 7.45. The next value is carbon dioxide level, and this will tell you if the problem is respiratory in origin. CO2 is the byproduct of cellular metabolism excreted via the lungs. Partial pressure of CO2, or PaCO2, in arterial blood is determined by how well the patient is ventilating. The normal range for partial pressure CO2 is 35 to 45 millimeters of mercury. Bicarbonate. Bicarbonate ions, or HCO3 negative, will tell you if the problem is related to metabolic changes in your patient and refers to the renal system. The kidneys secrete hydrogen ions and reabsorb bicarbonate when it needs to. The normal range is 22 to 26 millimoles per litre. As the blood pH decreases, becoming more acidic, the body retains bicarbonate, more base. As the blood pH rises, becoming more alkalotic, the body excretes bicarbonate in the urine. Be mindful that the compensatory mechanisms take hours and even days to occur. Here is a table to clearly outline the values. When the numbers in an ABG result fall outside of these ranges, you can then determine what type of problem the patient is experiencing. Remember to always treat the signs and symptoms of the patient first and escalate care. Acidotic or alkalotic. If the ABG results reveal pH numbers are not within the normal range, the patient's pH level is either acidotic or alkalotic. The lower the number, the more acidotic the patient is. Alkalosis is the opposite. The higher the pH, the more base is in the blood sample, which can disrupt the normal functioning of the body. Once you've determined whether there is too much acid or too much base, you can move on to determine the cause. So, is it a respiratory or a metabolic problem? After you've determined whether the sample is acidotic or alkaline, you need to work out if it's due to a respiratory or metabolic condition. If the cause is respiratory in nature, the partial pressure of CO2 will be out of the normal range, whereas for metabolic problems, the HCO3 negative will be abnormal. Arterial blood gas interpretations can be overwhelming to start with. So what does all this mean? How can we simplify it? Try drawing up a grid that looks like this. Many clinicians find this method visually easy to assist in the analyzing process. Using the grid, let's work through an example. The pH level is 7.3, carbon dioxide is 50, and bicarbonate 30. pH is out of range below 7.35, which represents acidosis. The CO2 is out of range above 45, representing acidosis. Bicarbonate is out of range, representing more of a base, placing HCO3 negative in the alkalosis column. Always pair up the pH with the value that sits in the same column. In this case, it's PaCO2. In this example, the patient is experiencing a respiratory acidosis, and the bicarbonate has moved out of its normal range, trying to compensate for the acidosis present in the body. Remember, the higher the HCO3 negative, the more base is present. So, has this compensatory mechanism been successful? Bicarbonate has moved out of its normal range of 22 to 26 millimoles per litre, however it hasn't done a great job. This is known as partially compensating respiratory acidosis. If it was a fully compensating respiratory acidosis, the pH level would be back within the normal range of 7.35 to 7.45. The goal now is to rectify the pH abnormality so the body is able to function in optimal conditions. Always remember to treat the signs and symptoms of the patient and escalate care. ABG should be thought of as a snapshot of how the body is interacting with its environment at a particular time. They should always be interpreted as a part of the wider assessment of a patient's respiratory function.